Hi, I'm Natalie Stagoski, and this is my final project for Business Data Analytics 513 on how the COVID-19 pandemic has affected unemployment rates in the continental United States. Throughout 2020, it is clear that the COVID-19 pandemic has affected the country and the world in a variety of ways. For this project, we are tasked with choosing a topic and examining how COVID has impacted that sector. One way that COVID has affected my family, friends, and myself is the increase in unemployment across the country. My family and friends have been laid off and furloughed. Others have been luckier and have moved to working from home, but have lost coworkers and faced major budget cuts in their companies. Myself and other students were hired for internships but have been canceled before the beginning of the summer due to health concerns, budgeting, and other various reasons. For these reasons and more, I thought it'd be interesting to take a look at how the pandemic has affected jobs in the United States. This overview shows a preview of what we'll be examining and the type of analysis I'll be conducting. We will explore the type of unemployment by geography in relation to the number of cases in each state versus their unemployment rates, by demographic, industry, and across history, across the United States history. But before we can take a look at unemployment, we have to evaluate the pandemic as a whole. How many cases are there in the United States? How many people have lost their lives? We are currently looking at over 200,000 individuals who have suffered and lost their life due to the COVID-19 pandemic, and over 7 million cases in the United States. From this chart, we can see that states with the most cases are the hotspots, such as California, Texas, Florida, Illinois, and New York. Other notable states include Arizona, Georgia, and North Carolina. It's interesting to point out outliers such as New York, who has over 400,000 cases and the most number of deaths in the US at 32,000, while California has over 800,000 cases but half the number of deaths. We can see that there's a little bit of a trend on the East Coast of cases, and there are deaths as well. The Midwest typically does not have as many cases other than Illinois, which has Chicago. It's important to note that the representation for the number of cases is for the state in its entirety. Many states do have cities in which the population is much larger, such as New York and Illinois with Chicago. These cities bring in a large number of cases rather than the suburbs of these states. In order to understand the significance of the current unemployment, we have to know the ideal rate and what that should look like. The Federal Reserve says unemployment should be between 3.5 and 4.5%. If it goes higher, the federal government will intervene with various fiscal policies to lower interest rates and create jobs where they can. And if it falls lower, it could cause inflation. So this shows the unemployment rate by color and the number of cases. So we can see here at the bottom is our states that we have with these blue bars representing the number of cases in each state. The green line shows the unemployment rate. The unemployment rate, which is what we're looking at, and the peak of the COVID-19 in the United States was at 14.7% at its peak in April. So the average should be somewhere around 16 to 12 would be a pretty standard size. But when we look at these outliers we have here, such as Michigan, we can see that the number of cases is typically low at just under 150,000, with the unemployment rate at 22%. This is a huge difference than what our averages are, the 300,000 with a 16% unemployment. Here we have California, which we noted earlier, at over 800,000 cases and a pretty average unemployment rate of about 15.5, higher than the national average, but very close. So there's various reasons why, and it's interesting to see when we look at why these states have lower cases but a pretty average unemployment versus very low unemployment and very low number of cases. There's a typical trend, but we do have a couple outliers here. Now we can look at unemployment by gender. So this chart shows from 2015 to 2020, the unemployment rates by gender, men being in blue, women being in purple. And we can see that it's a typical trend downward where we can see the unemployment rate has been decreasing the past 5 years, with men being slightly higher than women. When we look at 2020, we can see that women actually had a higher unemployment rate due to the pandemic. After its peak in April, women were a little bit higher than men, but it went back to the typical normal, you could say, before, as we see these unemployment rates decrease and openings in the United States come back up. And here we can also see from 2015 to 2020, the unemployment rate, this time by age groups. And it's a similar trend throughout the past 5 years. There's not a huge disparities between these age groups that is notable. But when we see that 2020, we can see that 25 to 34-year-olds have a much higher rate of unemployment than any other age group, especially those closest to them in terms of unemployment size and age. So this is notable, which we will look into more after we look at the industries and how they have suffered due to unemployment in the COVID-19 pandemic. So here we can see that non-agricultural and private wage and salary workers is the highest industry that has been suffered at just about 20,000 individuals. Leisure hospitality, accommodation and food services and drinking, these industries are directly affected by the COVID-19 pandemic because of the lockdowns, the quarantines, and the social distancing that's been in place for the past several months. And they've been opening back up, but there's still limited capacities even after states have decided to reopen their businesses. So this is significant to note because we can see that other industries such as self-employed workers, the arts, the constructions, they're smaller unemployment rates and sizes, but they're still notable as direct causes. The government wage salary workers stood out to me because my mom actually works for the government. She is in the Parks and Rec department at a suburb in St. Louis, and her budget is directly affected by, primarily is received from the sales tax in that city. So since the stores were closed down, restaurants were open, her budget and their department's budget took a huge decrease and huge hit. So they had to reevaluate how they were going to provide the services they do in the park. Now, it's also important to note that, and we look at, people were using parks for their activities during quarantine because it was a safe social distancing where they could walk and hike on the trails and not be around other individuals to spread the coronavirus. However, my mother's business and unemployment in the Parks and Rec department, they had to furlough many of their employees, so they couldn't keep up with the standard services that individuals expected. They had to spread out their individuals who, for example, if the pool didn't open, they had to move those individuals to other departments to keep the functionings running. So we can go back to unemployment by age, and we look back at 2020, we saw that 25 to 34-year-olds had a higher rate of unemployment than their other individuals. And we look at why that is. When we were looking at the food service industries, the younger age groups don't have the employable skill set in industries that they would still be thriving, such as the healthcare, the finance, and the tech companies. So these younger age groups would look more to the service industry, such as the food services and retail. Small businesses, especially restaurants and retail, are going out of business because even though they can open, like I said, they still have those limited capacities, which require a smaller number of employees, and they're not hitting the profits that they were prior to the pandemic. So even though the stock market is generally positive at the moment, it's the larger tech companies and healthcare companies that are driving the boom in our economy right now. Individuals in the younger age group are struggling because they are in the jobs that require a lower skill set and they have a higher probability of living paycheck to paycheck. And even though some industries are hiring, individuals may not have the skill set, the requirements needed to fill those jobs, which is why we can see that younger individuals are having a higher rate of unemployment right now. And now we can look at unemployment across the recent history of the United States. So in the past 75 years, we see the notable trends here on our trend line to figure out where unemployment is. And we can see that it's had its peaks and valleys in the notable times such as the 1980s, when we had high gas prices and high interest rates and changing government. Over here in the technological boom in the 90s, due to business decisions, interest loans, and those aspects. And here in the housing market crash of 2008, 2009. And these are all various aspects that affect unemployment in the United States, but it's important to note that in 2020, these are not because of government policies, businesses' decisions. This is because of a global healthcare crisis that we have this unemployment rate. It's unprecedented in recent history, in the recent decades, that we have such a huge healthcare crisis that has affected our economy and our unemployment rate. if we take a look at this graph and we adjust it to the recent years, we can see that unemployment has been steadily decreasing. We were at that 3.5% that the Federal Reserve says is an ideal rate. And we had the lowest unemployment rate across all demographics, age, gender, race, ethnicity. And we were, you could probably predict that we were thriving at this point. We had a very low unemployment. It was good for all demographics. And it was because of the global healthcare crisis that we hit that 14.2% at its peak. It's now around 7%. We're thankful that it has dropped back down, but it's still not that ideal 3.5% as before. So when we look at the recent history, the effects, and geographically by gender and age, we can see that unemployment is a direct effect of the global healthcare crisis. And we can see that the Great Depression in 1933 had a 24.3% unemployment rate. We noted these in the previous slide, the recessions and the Great Recession 2009 and the COVID-19 at its peak at 14.7%. So again, a direct effect of the global healthcare crisis. And here are my references. I use primarily the Data Hub provided, as well as several other workbooks to get all the data for this project. So thank you so much for listening.